Does your child have fever and coughing? Does your child also suffer from difficulty of breathing? Did your doctor diagnose your kid to have a pneumonia? In this video, we will talk about the myths about pneumonia, and we will bust those myths with real facts. Hey, I'm Dr. Kristine Alba Kiat, and my mission is to empower moms and dads so that you can raise happy and healthy kids. In this video, we will talk about pneumonia in children, and which are the hard, real facts, and which are simply myths. What is pneumonia? Well, it is an acute respiratory infection that affects the lungs. Our lungs have alveoli. These are tiny sacs that are filled with air when we breathe. But when one has an infection known as pneumonia, the alveoli are filled with fluid and pus, which makes breathing difficult and limits oxygen intake. Pneumonia is pretty serious, especially in kids less than 5 years of age. It affects children and families everywhere. Causes of pneumonia can be from bacteria, viruses, and fungal infections. Most common cause of bacterial infection is Streptococcus pneumonia, and the second most common is Haemophilus influenza type B. For viral infections, the most common is the respiratory syncytial virus. Now, let's bust out those myths. Myth number 1, pneumonia is only a winter disease. Well, this is a common misconception. In fact, pneumonia can occur all year round. It is a disease that can strike at any time. Myth number 2, pneumonia only affects the elderly. Well, this is not true, as pneumonia impacts all age groups. There are certain high-risk groups though for pneumococcal disease, and these includes adults who are greater than 65 years of age, those who smoke cigarettes, people with certain health conditions like cancer or HIV/AIDS, and of course, children who are less than 2 years of age. Myth number 3, pneumonia is not preventable. It is not true. In fact, prevention of pneumonia is possible. And this is an important strategy to combat childhood mortality. There are several things that we can do to prevent pneumonia in kids. First off is through immunizations, especially against Haemophilus influenza type B, pneumococcus, whooping cough, and measles. Another important strategy is through adequate nutrition. So, an example is exclusive breastfeeding for babies' first 6 months of life. And lastly, we can change environmental factors such as reducing indoor air pollution and good hygiene such as frequent hand washing. Then, myth number 4, antibiotics can cure all pneumonia. This is not true, as the treatment would depend on the type of pneumonia that one has. Antibiotics would treat bacterial pneumonia, but most types of viral pneumonia, for example, there is no specific treatment and patients can get better on their own. Other forms of treatment for pneumonia can include increasing fluid intake, getting some rest, adequate nutrition. Some would need oxygen therapy at the hospital, and fever control is also important. Myth number 5, pneumonia is not contagious. Well, let's clarify onto how pneumonia spreads. The viruses and bacteria can be found in the nose or throat of the patient, and this can go into the lungs when inhaled. So, pneumonia is spread through airborne droplets when a child with pneumonia coughs or sneezes. Another way that pneumonia can spread is through the bloodstream, for example, when shortly after birth. Myth number 6, pneumonia presents with obvious symptoms. Well, the truth is, pneumonia symptoms can vary and can be misleading. Symptoms might be different for each child. It's not always the same. Some kids would present with coughing, producing mucus. Some kids would have a painful type of cough. There might be vomiting, loss of appetite, being tired or simply just a fever. Some kids can have chills or fast breathing and just generalized fuzziness. There are also different types of severity of pneumonia. For children with mild pneumonia, it can be treated at home. But if your child's pneumonia is moderate or severe, then your child may need to be hospitalized for oxygen therapy, breathing treatments, IV fluids, IV antibiotics as well. Myth number 7, pneumonia is a mild disease. As was discussed, pneumonia can present as mild, can be moderate, or it can be severe. In fact, pneumonia can be life-threatening, which is why early intervention and treatment is important. Pneumonia can lead to complications, such as having severe breathing problems, and bacteria can enter the bloodstream as well. Hey, if you like this video, watch my next video where I teach you about other child health problems.